I'm a doctor, a public health expert and a mother. This is what people ask me, and what I tell them.
我是一名医生，一名公共卫生专家和一名母亲。这是人们问我的，也是我告诉他们的。
Ashita Batavia contributor.
投稿人8-10。
Minutes Ashita Est Batavia, MD, MSc, is a board-certified infectious diseases specialist and public health expert with extensive experience in epidemics, including the H1N1 outbreak. She lives with her family in Westchester County, NY, near the coronavirus containment zone in New Rochelle, where the disease first appeared in New York State. She works at Lawrence Hospital NIF Columbia, where the second COVID-19 case in New York was diagnosed. Ashita Est Batavia.
医学博士，理学硕士，是一个理事会认证的传染病专家和公共卫生专家，具有广泛的经验。在流行病，包括
H1N1
爆发。他和他的家人住在纽约州的威斯特彻斯特郡，靠近冠状病毒的遏制区，也就是疾病最初出现在纽约州的地方。他在纽约哥伦比亚的劳伦斯医院工作。纽约的第二个
COVID-19
病例被诊断出来。
Dr. Ashita Batavia. Courtesy of Dr. Batavia. Dr. Ashita Batavia. Courtesy of Dr. Batavia.
巴达维亚博士，由巴拉维亚博士提供。
Here are some of the questions she hears every day from friends and neighbors who are concerned about keeping their families safe.
以下是他每天从关心家庭安全的朋友和邻居那里听到的一些问题。
Can my kids have playdates? What if they ray with neighbors they play with all the time?
我的孩子可以有玩伴吗？如果他们和邻居一起玩呢？
Unfortunately, no. Social distancing is our best chance at curbing this epidemic. It means minimizing our in-person interactions with anyone outside our home. Children can be infected and can spread COVID-19 to others, including adults, for several days before they show symptoms. Symptoms in children are typically mild but can pose life-threatening risks to more vulnerable populations such as the elderly and those with chronic health conditions.
不幸的是，没有。社交距离是我们控制这种流行病的最好机会。它意味着最小化我们与家庭以外的任何人的面对面交流。儿童可能会被感染，并在出现症状前几天将
COVID-19
传播给其他人，包括成人。儿童的症状通常比较轻微，但对老年人和慢性病患者等较脆弱的人群构成威胁生命的风险。
Can I take my kids to the playground?
我可以带我的孩子去操场吗？
Unfortunately, no. In a crowded playground, it is nearly impossible to keep a safe distance of 6 to 10 feet from others. In less frequented areas, playground equipment is still used by multiple individuals and cannot be effectively sterilized, and the coronavirus can live on surfaces for several days. The only exception is playground equipment in your yard if it is not used by anyone outside your home.
不幸的是，没有。在拥挤的操场上，要和其他人保持6到10英尺的安全距离几乎是不可能的。在人迹罕至的地区，操场设备仍然被多个人使用，不能有效消毒，而且冠状病毒可以在表面存活数天。唯一的例外是操场设备在你的院子里，如果它不是由任何人使用你的家以外。
Can I still take walks outside?
我还能出去散步吗？
Yes, you can take walks outdoors, sit on your porch, or kick a ball around, as long as you are at least 6 feet away from people who do not live in your home.
是的，你可以在户外散步，坐在门廊上，或者四处踢球，只要你离那些不住在你家的人至少6英尺远。
However, people who may have COVID-19 based on symptoms regardless of whether or not it was confirmed, or who have been exposed to an infected person should self-isolate and limit their interactions with others, including members of their family. That means stay in one room, if possible use a different bathroom, and wash hands before and after handling items that others will touch, such as plates of food. If they must enter a shared space, they should wear a mask to reduce the risk of transmission.
然而，基于症状可能患有
COVID-19
的人，无论是否确诊，或者曾经接触过感染者的人，应该自我隔离，并限制他们与其他人，包括与家人的互动。这意味着待在一个房间里，如果可能的话，使用不同的浴室。在处理别人会接触到的东西之前和之后洗手，比如盘子里的食物。如果他们必须进入共享空间，他们应该戴上口罩，以减少传播的风险。
Can our nanny, babysitter, piano teacher, cleaner still come?
我们的保姆、钢琴老师、清洁工还能来吗？
Unfortunately, no. Only people living with you should be entering your home at this time. People can spread COVID-19 to others before they show symptoms. Please consider video playdates or virtual lessons for your children. Household work such as childcare and cleaning should be done by members of the household only. The only exception is for essential workers, for example, healthcare staff, law enforcement, grocery store employees seeking childcare or elder care arrangements while they serve their communities. If you are able, please consider continuing to pay people you employ your home while they are unable to work. The pandemic is causing widespread financial hardship.
不幸的是，没有。只有和你住在一起的人才应该在这个时候进入你的家。人们可以在其他人出现症状之前将
COVID-19
传播给他人。请考虑为您的孩子提供视频游戏或虚拟课程。儿童保育和清洁等家务活只能由家庭成员承担。唯一的例外是基本工作人员，例如卫生保健人员、执法人员、杂货店雇员，在为社区服务时寻求儿童保育或老人护理安排。如果你有能力，请考虑继续支付雇用你家的人，而他们不能工作。这种流行病正在造成广泛的财政困难。
Is it safe to go to the grocery store or pharmacy?
去杂货店或药店安全吗？
If you are healthy and haven't been exposed to anyone with COVID-19, then it is okay to shop for essential items like groceries and medication. Try to visit stores at off-peak times, wipe down cart handles with sterilizing wipes, and spend a minimum of time inside. If feasible, buy necessities in larger quantities to limit the number of trips. Try to keep 6 to 10 feet from others while you shop and wash your hands thoroughly afterward.
如果你是健康的，并且没有接触过
COVID-19,
那么购买必需品如杂货和药物是可以的。尽量在非高峰时间去商店，用消毒湿巾擦拭购物车把手，并在里面花最少的时间。如果可行的话，大量购买必需品以限制旅行次数。当你购物时，尽量与其他人保持6到10英尺的距离。购物后彻底洗手。
I am young and healthy. This is unlikely to affect me. Can I still go to the gym?
我年轻健康，这不太可能影响到我。我还能去健身房吗？
Unfortunately, no. It is difficult to adequately sterilize gym equipment between uses, and close proximity to others outside your home is strongly discouraged. Consider going for a walk or run outdoors if you can maintain 6 to 10 feet distance from others. In-home exercise, such as yoga or pilates, are safe alternatives, and a number of streaming services apps can provide guidance.
不幸的是，没有。在使用健身房设备和离家很近的地方给设备充分消毒是很困难的。这是强烈建议的。 如果你能与他人保持6到10英尺的距离，可以考虑在户外散步或跑步。在家锻炼，如瑜伽或普拉提，是安全的选择。一些流媒体服务应用程序可以提供指导。
Which is safer, takeout or delivery?
外卖和快递哪个更安全？
The risk with both is minimal, but not zero. COVID-19 may live on certain surfaces for many hours or days, so it's theoretically possible to get it by touching something an infected person has touched and then touching your mouth or nose. Please wash your hands before and after handling takeout containers. If you opt for delivery, consider asking for the items to be left on your doorstep to minimize face-to-face interactions from closer than 6 to 10 feet. Please consider tipping generously to support your local businesses and the delivery personnel that are putting themselves at risk.
两者的风险都是最小的，但不是零。
COVID-19
可能在某些表面存活数小时或数天，因此理论上可以通过接触感染者接触过的东西，然后再接触你的嘴或鼻子来感染。处理外卖盒前后请洗手。如果你选择送货，可以考虑要求把东西放在你家门口的台阶上，这样可以减少面对面的交流。不要超过6到10英尺。请考虑慷慨支付小费，以支持您的当地企业和送货人员。这是自己的风险。
What can I do to help?
我能帮上什么忙？
There are lots of ways to support your community.
有很多方法来支持你的社区。
Share your knowledge with others and empower them to act responsibly and reduce their risk of being infected with coronavirus.
与他人分享你的知识，并授权他们采取负责任的行动，减少他们感染冠状病毒的风险。
If you have elderly and vulnerable, for example, immunocompromised or with chronic conditions neighbors, call or schedule video conferences with elderly neighbors who may be feeling isolated or frightened. If you live in an area with home delivery of groceries, help them set up an account to reduce their exposure to others. Consider shopping on their behalf. Leave items on their doorstep to avoid face-to-face contact. Remember, this is to protect them as well as you.
如果你有老年人和易受伤害的邻居，例如免疫缺陷或慢性疾病，给可能感到孤立或害怕的老年邻居打电话或安排视频会议。如果你住在一个杂货送货上门的地区，帮助他们建立一个账户，以减少他们与他人的接触。考虑以他们的名义购物，把物品放在门阶上，避免面对面接触。记住，这是为了保护他们，也是为了保护你自己。
If you have unused supplies that can be used for personal protective equipment, for example, dust or painters, masks or face shields, consider donating them to a nearby hospital. Call ahead to check what they need and can accept.
如果你有未使用的个人防护用品，如灰尘、油漆工面罩或护面罩，可以考虑将它们捐赠给附近的医院。提前打电话核实他们需要什么，可以接受什么。
In areas where businesses are still operating, consider helping by buying gift certificates for services that you can use after the pandemic has ended, for example from nail salons, hairdressers or pet care facilities. Or order items online locally and spread the word in your community. We are all in this together.
在企业仍在运营的地区，可以考虑为流感大流行结束后可以使用的服务购买礼券，例如美甲沙龙、理发店或宠物护理设施，或者在本地网上订购商品，在你的社区中传播信息。我们都在一条船上。